Okay, we are going to talk about CPR or cardiopulmonary resuscitation. CPR is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chance of survival after cardiac arrest. Every year, 475,000 people die from cardiac arrest in the US. It's a big number, and it shows a bigger opportunity for life saving with CPR. And here we have an essential question, that why is CPR important? It's important because keeping the blood flow active, even partially, extend the opportunity for a successful resuscitation once the medical staff arrive on site. And CPR is a critical step in the chain of survival. We have 5 steps in the chain of survival. The first step is recognition of cardiac arrest and activation of the emergency response system, such as call to 911. The second step is early CPR with an emphasis on chest compression. The third step is rapid defibrillation. Step 4 is basic and advanced emergency medical service. And step 5 is advanced life support and post-cardiac arrest care. The other question is how is CPR performed? We have 2 common versions of CPR. The first one is for healthcare provider and those who are trained for conventional CPR that uses chest compression and mouth-to-mouth breathing at a ratio of 30 compression, chest compression to 2 mouth-to-mouth breath. And the second one of the second kind of CPR is for general public or for popular people that just witness an adult suddenly collapse. At this condition, we have compression only CPR or hand only CPR. The hand only CPR is without mouth to mouth breath. It is recommended for use by people who just see a teen or a adult suddenly collapse in an out of hospital area, such as at home, at work, or in a park or something like this. Hand-only CPR consists of 2 easy steps. The Step 1 is call 911 or send someone to do this. And step 2 is push hard and fast in the center of the chest. And at the end, there is one important thing that everyone must know, that there is differences between heart attack and cardiac arrest. Cardiac arrest.
Sorry to interrupt you. I've got the material. Do you want me to present it right now, or you can tell me when to present it?
Okay, after the finish the matter, okay, yes. So I said that the important things is differences between cardiac arrest and heart attack. These are two different things. Cardiac arrest occurs when heart stop beating unexpectedly, and cardiac arrest is an electrical problem of the heart. The patient with cardiac arrest suddenly collapse, and heart doesn't work, doesn't beat, and sometimes we have stop in breathing.
Any reason for that?
Yes, there is a different reason for that. One of reason may be a massive heart attack, but there is different reason for cardiac arrest. But when we have a heart attack, the blood flow to the heart muscle is blocked, and so patient have a chest pain, and sometimes patient have sweating and other symptoms, but it is different from cardiac arrest. And so heart attack is a circulation problem. If patient just have a heart attack, you don't need to CPR. But when you see a cardiac arrest, it's better to do CPR as soon as possible. Okay. So please play the video.
Is it a video or just I saw it's a PDF?
No, it was a video and a
there was a. Sorry, I just bring the PDF. You want me to present the PDF because we don't have much time, only 8 minutes.
Okay, yes.
Okay. Yeah. Let me share this material. Okay.
Okay, yes. It's just the differences between two kind of CPR. It's hands-only CPR and CPR, but trained people. In hands-only CPR, you just have a two-step. It's for public. It's for normal people. Just call 911 and just do the compression CPR without mouth to mouth. Just push hard and fast in the center of the chest, and do this to arriving the paramedics. And the second type of CPR is CPR, but by trained people, that it include the chest compression and mouth-to-mouth breathing. Yes. Okay. Done.
How does it work? Nothing about them. Okay.
I said all of this.
Oh, we
Yes.
talked about all of them.
Yeah.
Okay.
Yeah.
So it's only, by CPR, we mean only just chest compression with the two hands.
Yes. If we are not trained and we just want to help the patient till the paramedic arrive, it's better to just do the hand CPR.
Mm-hmm.
It's the American Heart Society advice.
So how do we know that the person is having a heart attack or a cardiac arrest?
In a heart attack, patient is conscious. He has a chest pain. He complain about the chest pain, and maybe she or he has sweating or other symptom. But when you have a heart attack, if it is a massive heart attack, you may have cardiac arrest as a result. After a massive heart attack, you may have a cardiac arrest as a result. But first of
So what are
all,
the
you may
symptoms of cardiac arrest? If someone has
in cardiac arrest, suddenly patient collapse. He or
just faint.
she, yes, faint. She or he doesn't have a beat.
Mm-hmm.
Sometimes she or he
They don't have any pulse, huh?
Yes,
no pulse.
No pulse. And sometimes she or he doesn't breathe, and sometimes,
Mm-hmm.
not all the time. But I think the main sign is that she or he is unconscious and doesn't have pulse. And
what about breathing? Do they breathe or they stop breathing as well?
Sometimes a patient stop breathing, but in somehow she or he does breathe.
Mm-hmm.
Yeah.
Okay.
In case of non-breathing, the paramedics do the mouth-to-mouth breathing.
Okay. Thank you, Homera, for your lecture. Students, do you have any questions from Homera? Do you have any questions for Homera? No? Yes? Just unmute yourself, please, if you want to talk.
No.
No questions?